Well, this province is critically short of nurses. There's an estimated 600 vacancies province-wide, and a recent survey warns there could soon be more. Now, two nurses in rural Newfoundland are speaking publicly about the challenges of the job. CBC News has learned the health authorities are trying to fill the gap with a costly replacement. But the union says, well, it's a slippery slope. Our CBC Investigates reporter Ariana Kellen joins us now live with more. Hi, Ariana.
Good morning, Martin.
So let's start off here with the lay of the land a bit. 600 vacancies. How does that translate on the ground?
Yeah, well, the Registered Nurses Union has been beating this drum for years, warning that a nursing shortage is damaging for the nurses who are left, but also to the patients who require care. So that 600 number, of course, that's looming over the province. Those are the vacancies, but there are also 900 nurses eligible to retire right now. So that's also a figure that the union has been looking at. And a recent survey of 700 registered nurses locally produced some sobering statistics. Half of the people they spoke to suggested they'd sacrifice their permanent job for casual work. 1 in 6 said they were thinking about leaving the profession altogether. Nikki Parsons has been a nurse in rural Newfoundland for 31 years, and she's lived through some pretty tough times when nurses in the province were at odds over staffing and pay. I'm sure a lot of people remember the demonstrations from the 90s and the early 2000s. But Parsons says this has been the worst.
If you had asked me 2 years ago if I wanted to retire, I would have laughed. Every day, I think about retiring. And anybody who knows me knows how much I love my job, and that is so abnormal for me to say. Well, it's disheartening. You know, you go into work, we're always short-staffed, morale is really low. You know, I understand management tries to do things to bring up morale, but it's really hard when you come into work and you don't know if you're going to have someone to help you.
That's Nikki Parsons, a registered nurse. And, you know, Martin, it is rare to hear such candor from a nurse because they're often not allowed to speak publicly. But Parsons says it's time for the public to hear what working conditions are like, and also that nurses are fighting for better staffing, which in turn will mean better care.
So why has she decided to stay in the job?
Well, simply Nikki Parsons still loves being a nurse, and so does Lauren Byrne, who is an ER nurse working in rural Newfoundland. She's been a nurse for 13 years. She says she loves her job, but she says for too long that job has been taking priority over her life, including time with her family.
You know, you ask for a day off 6 months in advance, but there's nobody to take that day. Like, there's no staff to cover that day. So you know your child's concert is going to be on this day in, weeks from now. But there is nobody to fill that void. And you can't just not go to work. Like, you can't leave, say there's 3 nurses. You can't only work with 2. Someone has to be that third nurse.
That's Lauren Byrne there. And, of course, she spoke a lot about the camaraderie. You don't want to leave your coworkers in the lurch, but at the same time, you also need to make sure that the patients get the level of care that they need. So it's a tough spot. So for Byrne, it means that it's a lot of broken promises for her 2 children. Last year, she decided to go from a permanent employee position to a casual one, allowing her the flexibility to schedule her own life. And as I mentioned, there are plenty more people thinking of following that same route, even if it does mean giving up their pension.
So 600 nursing vacancies. I mean, we hear about the consequences of that in the news all the time. I mean, there's a shortage of beds in a hospital, but really that means a shortage of people to staff it. So what's being done to alleviate all this?
Absolutely. And it seems like summer is usually the time when we hear more of this, right, when people start going on holidays. But the Nurses Union says that it wants concrete, short, medium, and long-term solutions that will go beyond temporarily helping a summer staffing crunch, for instance. But what CBC News has learned is that the health authorities have signed on to use private agency nurses. Now, these are nurses employed by private companies across the country which offer competitive wages, free travel, and incentives. Now, travel agency nurses have been used in northern parts of the province here before, especially in those hard-to-staff regions like on the Labrador coast. But now every health authority are using them. So these are the numbers. Between January 1st and July 1st, Central Health hired 46 travel nurses at a cost of over $400,000. Labrador Grenfell Health spent over $1 million on 46 travel nurses. Eastern Health started using agency nurses in May. 14 have been hired through different agencies, and they say that a 12-hour shift costs the health authority over $1,000. It did not provide a total cost. Now, Western Health has not used travel nurses yet, but I did get confirmation yesterday that they too have signed a contract stating that they intend to. Now, Yvette Coffey is president of the Registered Nurses Union, and she says that's an awful lot of money going into the private sector for public service.
It's a very slippery slope. So we know that across Canada now, agency nurses are being used in every single province. We know that Ontario is now calling for a ban on agency nurses. We do know one of the western provinces, in recent months, there was a team of registered nurses who walked out of an intensive care unit as permanent staff and walked back in the next day as agency nurses as a team.
So Coffey says she's checking in with the government to make sure there's something in place so that doesn't happen here. But she says it's concerning that nurses working here, they're stressed, they're overworked. You know, it's possible that they may leave for those opportunities.
So we're short 600 nurses, another 900 eligible to retire. I mean, what else can the government and health authorities do here?
Yeah, well, that's exactly what was asked at a nursing think tank held in the spring between the union and the province. All sides I spoke with say it was a very positive step that was also applauded by the national union president, but it's been months now without change. Coffey says mandated overtime has to stop. There needs to be flexible scheduling, better access to childcare. Nikki Parsons also said there was a big issue with the lack of other staff like porters, LPNs, secretaries. In a sit-down interview with Health Minister Tom Osborne last week, he said the use of private agency nurses is not part of the long-term plan.
I think it's important that the health authorities use whatever tools they have in the toolbox to
How much time do we have left?
Fill the gaps. However, the priority is on recruiting and retaining public servants in this province to fill those roles. And you know, that is where we are going to focus. We would rather have nurses that are members of the RNU, a professional association, and employees of our health authorities filling these positions. So that is the focus.
That's Health Minister Tom Osborne. They're saying they need to do a better job, short on specifics, but he says an announcement is coming.
All right, Ariana, thank you for this story. Really appreciate it.
Thank you.
You can read more on this story on cbc.ca.